Well, let's talk about it. Coffee is one of the most consumed drinks in the world. Joining us this morning is Dr. Richard Chaffoo, right?
Right.
Oh, I said it right. To talk about how it can help reduce the risk of diabetes and debunk coffee myths. Let's start with a new study out of Greece. Coffee drinkers were about half as likely to develop type 2 diabetes as those who didn't drink coffee. So the big question is, why?
You know, Brad, it's a good question, and actually that study was an interesting study. It was over a long period of time. They looked at people that didn't actually drink coffee, those that had small amounts and those that were moderate coffee drinkers, more than 1.5 cups a day. And they found that those people that had diabetes were less likely to be regular coffee drinkers. We think that, we're not sure, we think that they looked at some markers that actually you find in the bloodstream. One of them is called serum amyloid and the other is called C-reactive protein. And those are markers for diabetes, and they actually go up before one gets diabetes. And they found that those that were, habitual coffee drinkers had lower levels of those markers than those that did not.
That's pretty amazing, that they're finding out this stuff. So another big question is, how many cups should we drink a day? Should we limit to 1 cup a day? Should we do 3 cups a day? How many cups?
So the studies were interesting and they're all over the place, but average is about at least 1.5 to 2 cups a day.
1.5 to 2 cups a day. And we were talking about Charlie's drink over there. It's about 40 ounces over there. So as a female and male, does it affect us different, being male than female? Look at that thing.
Wait,
that's a big cup. That's a big cup.
Dr. Chaffoo, look what it says. It says purgatory. It says the anguished, prolonged period spent waiting for a fresh pot of coffee to be ready.
Well, there you go. So
I didn't know that was a word.
And she refill that at least 3 or 4 times.
Liar. I've had 1 cup of coffee all day. Liar.
Watch. Anyway, so the difference between men and women, will it affect her different if she drinks that than,
well,
than
some
the
of
guys?
the studies interestingly found more of a protective effect in women than in men, but we don't really know why. And again, these are studies, the listeners should understand that these are not that well controlled studies. I mean, they are studies of large numbers of patients over long periods of time, but they're based on questionnaires and they're based upon, someone's recollection. But there is a long-term compelling evidence, a little bit controversial, of course, and the more studies are needed, but very interesting information.
There's so many studies out there, and another one that we can talk about is lowering the risk of other diseases like Parkinson's and Alzheimer's, at least the risk of.
Of course, there was a study that came out from Finland and Sweden, which have a large national health insurance plan, and they can follow people for a very extended period of time. They looked at almost 1,000 people over a long, prolonged period of time, and they found that the risk for Alzheimer's and other neurological diseases was about 63% less in those people that were, in their study, habitual coffee drinkers, which was about 3 cups of coffee a day or more.
There's so many different types of coffees out there, and I was talking to you a minute ago, I really don't drink coffee. There's some days on this show where you just have to. You have to get into a cup of coffee. Ours are empty this morning. Are you a coffee drinker, or do you?
I'm more of a tea drinker, but caffeine, we think that the caffeine effect is probably also found, obviously, in teas as well as in coffees, but, ounce for ounce, there's less caffeine in most teas than there are in coffees.
Okay, all right, so I'm a tea drinker, so that's okay. I mean, there's benefits of drinking tea as well.
Yes, exactly.
All right, we want to play a game of true and false this morning. Charlie's ready over there. The questions are, all right, let's go to question number 1. Doctor?
Okay. Yes.
Dark roast coffee has more caffeine than light roast coffee.
True
or false?
False.
False.
Unfortunately, you would think just the opposite, because you would think, Brad, that if it's dark roasted, it's obviously it's richer, it's fuller. You would expect there's more caffeine, but the actual reverse is true. There's more caffeine in the lighter roasted coffees than in the darker roasted coffee. So if you're going to choose one and you want less caffeine, choose the darker roast, and it'll taste a little bit better too.
Choose the darker roast. All right, question number 2.
Okay.
True or false, Charlie? We should get the buzzer out for you. You should drink coffee before you work out.
True
or false?
That's true. That is true. Actually, there was an interesting study in the Journal of Applied Physiology where they looked at people that were actually working out, and they found that those people that had a cup of coffee before their workout, being on a stationary bicycle, 2 things happened that were interesting. One is they felt that the workout was actually easier for them to perform after they'd finished it. And secondly, and maybe more importantly, they consumed 72 calories less for breakfast than those that didn't consume caffeine.
Wow, that is really interesting. Interesting. All right, number 3, you shouldn't drink coffee on an empty stomach. True or false?
True.
I'm going to say true, yeah.
She's on a roll, exactly. I mean, it's true again, and most researchers would say the same thing, and there's probably a couple reasons for that, Brad. One is we know that anything you put in your stomach stimulates what's called hydrochloric acid, which is one of those chemicals that digest food. So if you have an empty stomach, you get up in the morning and you take that, that jolt of coffee, it's going to stimulate more hydrochloric acid. But it's on an empty stomach, so it's going to irritate your stomach, get some gastritis. And also, as importantly, if you've already released those chemicals like hydrochloric acid, and then after that you follow that with a meal, it's hard to digest those complex proteins, so you're more likely to get bloating, some nausea, vomiting on occasion. So if you're going to drink the coffee and not have something to eat, at least put a little bit of milk in it or a piece of toast, something in your stomach
Maybe
beforehand.
the cream, was that okay?
Yes,
the cream
is good too.
Cool. Finally, this is the question that Charlie, when we came in this morning, when she said, I understand you're doing this segment. Will you ask the doctor? Because I got to know.
Why are you
Coffee
making up
fixes
lies?
hangovers. True or false? True or false?
False. Even though
Actually-
you want it to be true?
Actually true.
Really?
It is true.
It is true.
It fixes
And a
hangovers.
very interesting study that came out of Thomas Jefferson University. They took these lab rats, which is really interesting. Now, we don't, the part of the reason why alcohol causes headaches or hangovers is because of the production of acetate. Now, there's some dehydration issues as well.
Right.
But what they did is they looked at these lab rats and they actually gave them a certain amount of alcohol, like an open bar for rats, I guess. And they went ahead and had the alcohol, and then they tested their blood alcohol levels of acetate a few hours later. They found they were elevated, and clinically what happens in a lab rat when they have a, quote, hangover, you can touch near the eyelid, and they're very, very sensitive. So they knew they were sort of in a hangover phase. And then they actually gave them a small amount of caffeine along with an NSAID, and it actually blocked and lowered the levels of acetate and reversed those findings. So caffeine along with aspirin may be the best way to treat it.
There you go. Hey, real quick, I know we got to wrap real quick, but this is an important question because I know I drink my tea with a straw because I'm worried about my tea staining, and some people, they drink the coffee. Of course, they're right up on it. Is there a quick way that we can stop the staining when we drink the coffee and the tea?
Probably the best way, Brad, is what Dennis would tell you, and that is to go ahead and brush your teeth afterwards if you can.
Simple enough, brush your
Right.
teeth. All right, if you want to get a hold of it, thank you so much. This was interesting. Dr. Chaffoo, information is on our website, fox5sandiego.com. Just take your coffee cup and click right on the scene on tab. Thank you so
Cheers.
much.
Thanks,
Great
Brad.
stuff.
Cheers.
Cheers. Back over to you, Sean.
Hey, by the way, post your coffee if you can online. Okay, cheers.